Hello everyone, it's Dr. Kerry Yerke. Welcome to today's webinar where we'll be going over what can make your 2021 better than it was in 2020. We're going to use some of the tips that we give our clients on our one-on-one coaching and our mastermind groups. We're going to give you some of these tips today on this webinar so you can improve your practice in 2021. So looking forward to 2021, what can you do better? And sometimes it seems a bit challenging to bridge the gap between where you are now in 2020 and where you want to be in 2021. And so for you, it's going to require some knowledge and some motivation and then focus. And the great thing about coaching is we can help you to determine what you need to focus on and then help you with some accountability to make sure that you achieve those goals, to do the right things so that you can excel in practice and business. So who is True North Practice Management? True North is a consulting company that I started just over a year ago to help health professionals with their practice, more on the business side of things. And what I found when I graduated over 25 years ago is that I was well trained at what I do, skilled health professional, but we didn't get a lot of training on the business side of how to run a practice. How do I start a practice? How do you hire and manage people? How do you manage patients better? So we were just taught how to treat, but we weren't really taught much about business skills, very little. And I had to learn that along the way, and I hired consultants myself to help my practice. And it really did help me to focus, to learn, and to become a better business person. So what I thought is one day I'd like to give back. I'd like to help young health professionals with their practices. And so I started True North Practice Management with that goal in mind. So what do we do at True North? Well, we offer webinars. Some of our webinars are free. They're kind of general webinars just to share what we do at True North. Some of them are paid, like this one, where we get more into specific topics and specific advice that we give our clients to improve their practices. We started a mastermind group, and this group meets monthly. And for the mastermind group, we give tips on a weekly basis via email or text. And then for the mastermind group, we get together. It's a shared forum, and we have different topics that we go over at the mastermind, topics that are relevant to what our clients are talking about right now. So the mastermind group helps with support for our clients. It helps for people who are interested more in our services. Maybe they've taken a free webinar or a paid webinar and they're thinking about coaching. The mastermind group is a good gap, the next step between the paid webinars and the one-on-one coaching. For coaching and mentoring, most of the clients that we talk to on a weekly or bi-weekly basis. For maintenance, we talk to some of our clients on a monthly basis. And basically, what we're doing is finding out where they're at in practice, finding out what their vision and their mission is, and then talking to them about a plan and then following up on that plan. So it's really a great service. It more than pays for itself throughout the year, and plus you grow as an individual and as a person, as a business person. So I think it's a wonderful service. So we do have some room for clients right now, although we do have a maximum number of clients that we can take on at this time. So there still is some space for the coaching for 2021. We started a company called Healthcare Classified. Healthcare Classified is a business classified for healthcare professionals. It came out of the demand that clients had for finding people, finding doctors and therapists, finding skilled administrative staff. So there were a number of different opportunities that our clients wanted to advertise, and we put that up on our website, True North Practice Management. But soon that became a popular theme, and what we decided to do is build a separate company and a separate website called Healthcare Classified. And on that website, you can post your opportunities, and new doctors and therapists can go there to find opportunities for them. So it's a really great website to be able to share opportunities that are in the healthcare field. I think with any discussion, the first thing that we need to talk about is vision. So what is your vision for 2021? And the vision is important because it's what you can see yourself doing. It's what you can see your practice doing in 2021. So everything starts with a vision, and that's important that you're thinking about that you can share that with us, whether it's on a webinar, mastermind group, or coaching. We want to know what your vision is, and sometimes we want to spend a little bit extra time on that vision to make sure it's really clear for you and for us going forward. The second thing is a sense of purpose or a mission. Why did you become a health professional? Why did you start a practice? What do you want to do with your practice? And what type of impact do you want to have on your patients and the community at large? Maybe eventually you want to make a bigger difference for other health professionals, kind of like what we're doing here at True North, where we're going to help and support health professionals on their journey. So having a greater sense of purpose is important, and that follows the vision that you have for yourself and for your practice going forward. One of the topics we wanted to talk about today is how to increase referrals. And referrals are usually organic or internal. So you're treating patients, the patients are really impressed with your care. It could be the work you're doing, and it could be the fact that you're listening to them, you're relating to them, you're discussing, with them what the plan is for their health going forward. So all of that is very important. And I just was on a webinar yesterday on the receiving end, and the doctor was a specialist in communication with patients after the first visit. And when I listened in on that, one of the biggest takeaways for me was just listening well to the patient. So just listening, giving them time to talk and ask questions, finding out more about them, and then relating to them. That's very important for what we do. And you will get the referrals from excellent patient care. So as you're getting results and as the patients become more excited about the way they're feeling and what they can do, they're going to share that with other people. And they're going to send their family members into the clinic. They're going to send their friends. And this is a very good indication that you're on the right track for your practice. In addition to that, we also want to talk about social media, because social media has become increasingly important. I think health professionals have been slow to adopt social media just because we're busy. So social media is really important. And what I've found is posting regularly and frequently is important as well. So it's almost best to work with your team on this and put somebody in charge of your social media. Give them a framework of what you want them to post. And I find most of the posts should be educational, but there should be some posts that are about you and your team, about your patients, about testimonials, your hours, your location, things you're celebrating in your clinic. So there needs to be about a 20 or 30% component of more personal posts, and the majority about the services you offer, how they work, the products you offer, and how they work. So Social media is important. It's good to repost, especially the posts that are doing really well. And you can look at those. You can click on your Insights tab, or you can use a social media manager. We use Buffer. We really like it as a analysis tool to help you to determine which posts you should repost, and then which hashtags you should use, and what content is working. So we can talk more about social media at another webinar or at a mastermind group, or even the one-on-one coaching, but it is very important to add to your new patient totals that are coming into the clinic, as well as just have a presence in your community. So marketing is important. It's one of those things that we like to put aside a budget for. We do want to see increased spending in the marketing area. We'll talk about expenses on this webinar, but this is one area we want to see you spending a little bit more money on and getting more and more results, better, more new patients from it, and just getting a wider reach, because we want to see your clinic grow and the opportunities that leads to. How can you increase revenue in 2021? Well, increased revenue comes from more new patients. It comes from more services that are offered, and it comes from more products that are sold. So we talked about giving great service. You also should be asking for referrals. So one of the things I talk to my clients about is handing out cards, giving each patient a few cards. And I just use a general rule of thumb of giving them 4 cards and asking them to tell their friends and family. And so periodically in your clinic, maybe a certain day each month, or during the course of a certain week, you want to make sure your patients have cards and are referring people to you, and they know you're accepting new patients. So that's very important. And especially when the patient is excited about your care, they are telling you that they're sharing what's the results that they're achieving with others. So when people are excited about your service, that's a good time to reinforce that you are accepting new patients, give them some extra cards, and encourage referrals. So more products and services can come from a better focus with the patient, better communication, a better plan of action or a care plan with the patient, as well as products that are going to support the patient's healing process and what you want to accomplish with better function, better lifestyle. So it's important to have a clear plan for the patient and have a clear plan for your clinic as far as which services are being offered and which products are being sold. How can you decrease expenses in 2021? Well, one of the things we like to focus on is variable costs. These are costs you can control. And so when you're looking at your variable costs and you run down your expense sheet for last month or the last quarter or 2020, what you want to look at is what expenses can you control and what can you trim. Some of the expenses you might want to contain our wages. And that depends. If you're growing as a clinic, it's hard to contain wages, but because you have to have staff available to do the work. But you can also make the clinic a little bit more efficient. You can cut down on some of the costs. You can schedule your staff better. So that's another thing you can do. So we look at the variable costs, the costs that you can control, and then the fixed costs too. And those are costs like when you go to renew your lease, the financing you have at the bank, the interest rate, and the terms. So there's a number of different fixed costs that come up on a monthly or yearly basis that we can take a look at and help to reduce the cost going forward of those expenses. So that's what we look at reducing expenses in the clinic. How can you reduce stress in 2021? Well, this is somewhat subjective, but when we ask professionals, well, what causes stress for you? It could be things like your scheduling. And so we'll talk about that in a minute. It could also be stress from your team, your staff, and could be stress from the things you're doing outside of the clinic too. So we really want to pinpoint what's causing the stress and what can we do to mitigate that, reduce that stress, and if we need any extra help or outside help for that. So maybe we have to hire a third-party contractor or bring in somebody to help with the stress in the clinic, or even some counseling sometimes is good to help with things like stress professionals that are under stress. And one of the things to help with stress and to improve your service is teamwork. It's important to put effort and energy into training your staff and getting together to review the vision and the mission for the clinic. So I like to have shorter and more frequent staff meetings, and I encourage my clients to meet with their staff on Mondays and Fridays, the first day of the week and maybe the last day of the week that you have in your clinic. I just use Monday and Friday as an example, but just get together on Mondays, talk about the week ahead, talk about the goals for the week, the goals for the month. And then at the end of the week, you want to spend some time just reviewing how did you do and what goals did you achieve and how could you do things better for next week. And then, wish everybody a great weekend and see them again on Monday to refocus. So that's what we did and we do in our clinic. And it works really well to keep everyone focused and to educate staff. Sometimes you want to have training days or you want to have staff training each other on certain areas. Sometimes you want to take courses too that'll help you to do a better job in your clinic. And quarterly, I recommend that you get together with your staff and have a really fun meeting where you spend a couple hours going over how the quarter went, what you're looking forward to for the next quarter, and then going over some metrics of how the clinic's doing. So I highly encourage you to have meetings, invest in your staff, and that'll bring you much better teamwork and better collaboration in the clinic. Systems. I'm big on systems and efficiencies. So looking at the different steps in the clinic that the patients go through, from the new patient process to the follow-up care, to the recommendations you're making, to scheduling visits, to handling missed appointments. So anything like that, it's important for you to look at your systems in the clinic, look at the steps, and make those steps more efficient. So if you have extra steps in the process, try to eliminate those if possible, and just make the clinic flow a lot better. And then time management. This is a popular topic for professionals and staff. How are you managing your time? So time management, running a clinic that's on time, that people are really happy versus behind and stressful for the staff, and the patients are complaining. So it's much better to run a clinic that's on time, and even your own personal schedule. So for the schedule, how are you booking your new patients, your follow-up visits, and maybe things like re-examinations or special appointments. So how are you organizing your calendar? Do you have times during the day or the week where you can put people in to better serve them and to keep your staff happy as far as scheduling goes and reducing the stress that they have? And then your personal schedule is important. A client of mine this week, they're setting up a new clinic and they're working long hours. And one of the things I recommended for them is don't lose sight of the fact that you have to eat healthy. You need some time for lunch. You have to still exercise or time in the evening to work out. And it's okay if the stress is short term, it's the next week or two, but we just don't want to see that stress lasting a long period of time. So when it comes to scheduling, it's kind of a roadmap for us to look forward to our week, to do things that make us happy and leave some space for some flexibility too. So I do talk to my clients and at the mastermind groups about just scheduling time so that you keep a well-balanced lifestyle, not just in the clinic, but outside the clinic too. How do we measure success? And this is an important topic. A lot of people think about metrics. Maybe it's financial. How do we do this year compared to last year financially? And that's very important. To have numbers tells a story, but also we want to have some qualitative factors that we can use to measure a success as well. So how do you feel? How do you feel about the clinic and how you're doing in the clinic? How does your staff feel? How does the team feel about what you've accomplished? And then we can also measure success. So how do the numbers look? How do the graphs look as far as the new patients that are coming into the clinic, the number of services you're offering, the products? So we want to look at those financials as well, the number of hours you're working, and then your expenses and the bottom line, and what you're doing with the positive cash flow. All of these factors are very important in the future success for you and how you measure success. I want to thank you for joining us today on this webinar, and if you're interested in the topics we discussed today, we'll be breaking out these topics into individual paid webinars going forward. Our paid webinars are every couple weeks. You'll see them posted under our events tab on our True North Practice Management page on Facebook. You'll see these events on our website as well, and we'll be offering them on Eventbrite. So you can join us for those webinars as well. If you're more interested in joining True North, the Mastermind Group is great because you get weekly tips sent to you. You do get to join our group on a monthly basis to talk about your practice and relevant topics, things that have come up during the month from our clients and what we're focused on in the current environment. And then the one-on-one coaching. I think the one-on-one coaching more than pays for itself over the course of a year. And most of our clients do bi-weekly, every 2-week coaching sessions. They're usually about half an hour to 45 minutes in length. We do that on the phone, or we can use Google Meet or FaceTime. And then we provide email and text support in between those sessions to follow up on what we discussed. So the coaching is a wonderful way to really accelerate your growth, learn a lot in a short period of time, and avoid making costly mistakes. So we do have some spots available for coaching in 2021. If you'd like to schedule a free initial consultation, we're going to offer you that and put a link in the events tab. So please feel free to reach out to us. You can DM us, and we'd be happy to send you that link. We can set up our first phone call and just find out where you're at, what your needs are, what you'd like to focus on in 2021. And then we can determine, how we can help you, what we can do to provide assistance to your clinic, and how we can help you make 2021 a better year than it was in 2020. I want to thank you for joining us today, and we look forward to seeing you at future webinars, as well as at our mastermind groups and the one-on-one coaching going